Hi, this is Andrea Kane, and I'm here with you for HIT 330, Healthcare Delivery Systems. We are talking about Chapter 15. This is the quiz debrief on that chapter. There were, looks like 5 questions that we might want to talk through. First one I would like to talk about is number 4. Blank is a specified amount of money paid to a healthcare plan or doctor to cover the cost, excuse me, of a healthcare plan member's services for a certain length of time. This is capitation. Capitation was the correct answer. If you look in your book, let's see here. What page did I see that on? I know it was here. I remember seeing it. Yes, page 492. 492. Capitation is a specified amount of money paid to a health plan or physician to cover the cost of a health plan member's services for a certain length of time. That was on page 492. So capitation is one of those types of reimbursement, pay for performance, it's a type of reimbursement methodology, and unfortunately it's here to stay with us, so you really kind of need to know that one. All right, next one I wanted to talk about was number 15. Even though only 4 people had it wrong, I wanted to talk about case mix. Case mix is calculated by looking at Medicare discharges for a defined period of time, adding them together, and then dividing by the number of total discharges within that period of time. That is the definition for case mix index. And let me find where that is listed here in your book. Page 493, case mix index. And that is listed right there underneath. The hospital's case mix index, or CMI, represents the average MSDRG relative weight for a particular hospital. The CMI is calculated by looking at the Medicare discharges for a defined period of time, month, quarter, year, adding them together, then dividing by the number of total discharges within that period of time. So that is the definition for case mix index and where you can find it. We will talk more about case mix index as we go on, but it is an important definition to have under your belt to know. Number 18, again, only 4 people had it wrong, but I wanted to talk about it because I think the concept is important. Clinical data is used to identify an individual and includes such information such as next of kin, insurance payer type, and home address. Why is this false? You can tell right away. Clinical data. Clinical data is not next of kin, insurance payer type, and home address. That's demographic information. That's not clinical data. Clinical data is lab results, vital signs, diagnoses. All of that is clinical data. Vent rates. It's none of that has anything to do. Next of kin, insurance payer type, and home address, those have nothing to do with the clinical care or the clinical status of the patient. That's why it's false. So you can tell it right there. And let's see, does it have in here about demographic data? I think it does under registration. Is that where I remember seeing it? Let's see here. I thought I remember seeing demographic information in here versus clinical information. And you know what? I'm not seeing demographics listed. All right, so I will give you credit because that may not have been specifically addressed in this chapter. It's information you should have had prior to this chapter in terms of basic knowledge. So that's why I expected you to have it at this point, and because we do talk about how demographic information is collected in the charge capture process. But you need to know that is not, demographic information is not clinical data. So I will credit you if you had 18 wrong, simply because it wasn't in the chapter, but it's basic information I would expect you to know by now. Number 24. Again, only 4 people had it wrong, but I want to talk about it. Retrospective utilization review processes involves utilization of information before the patient has been discharged or the care has been completed. Why is this false? It's false because retrospective is after the fact, and this says before. So that's why this is false, that wording. And I do believe this was covered in your book. Yes, retrospective review includes review and analysis of actual utilization data after the patient has been discharged. After. So that's why that one, and that's on page 490. So that's why that one is false. Now down to this last one, 25. The Centers for CMS, or you can just say CMS, is a private, not-for-profit organization whose mission. Okay, right there, stop right there. Is CMS private, not-for-profit? Absolutely not. CMS is part of the government. They are public. They are not private. They are government. And they are absolutely not for profit. I mean, granted, they don't profit, but CMS is a government entity. They're not a private nonprofit organization. And they also don't accredit, assess, or report the quality of managed care plans. They don't do any of that. So that's what should have given this one away as false. The correct answer on that is NCQA. NCQA is the correct answer, and that is on page 481. That is who is the private not-for-profit organization. So that is that one. All right, I'm sure the next quiz debrief I'll be back with will be chapter 16, fraud and compliance. And so we'll catch up on that one shortly. Take care, thanks.